welcome to Healthcare Hoax videos. I'm Janet Cimorelli. I'm here with Dr. Slavin. We're talking about headaches and we're talking about the symptoms and the causes, and today we're talking about testing. There are so many different tests that, in addition to speaking with your physician to understand underlying contributing factors, there are actual black and white test results that you can use to potentially uncover the causes of your headaches. Dr. Slavin, what are some of your favorite tests?
I like to first start off saying you don't always have to resort to testing. You know, a good history from the patient will often give you, reveal the underlying cause, and you can correct it without testing. But if you're stumped, you know, the patient continues to have headaches despite all the different things you've tried, then you want to start looking at nutrient deficiencies, even hormonal imbalances we mentioned. You want to check for that. Look for allergies, food allergies, and inhalant allergies or airborne allergies. And then if all else fails and we haven't gotten a result yet, you look at the comprehensive digestive stool analysis. That's going to give you a look at how your digestive tract is working. A common cause of headaches might be an overgrowth of yeast in your body, candida. So, and that's very common, especially if you've ever taken a course of antibiotics.
So important to know all of these little details that can help uncover the causes of your headaches. And so when you talk about testing for hormone imbalances, might you include thyroid? I think that when you have a subclinical thyroid condition, it's pretty common to have issues with headaches.
Well, when we do testing, we're not specifically looking for the cause of the headache or the underlying problem. Instead, what we're looking to see is the body functioning properly. So if your hormones are off, whether it be sex hormones or thyroid hormones, that's going to interfere with the body's ability to function normally. So if you give your body every opportunity, it's going to heal itself, it's going to stay healthy. But if you have these problems, the body can't heal itself, can't respond normally to any challenges, and then you have symptoms like headaches.
What about cortisol? Does an overly high cortisol level play any role with regard to headaches?
Well, cortisol is a stress hormone, so it could be an indicator of stress, which can be associated with headaches, obviously. Since you brought up cortisol, I'd just like to point out, when we talk about hormonal imbalance in women, when they're under stress, they'll make cortisol at the expense of progesterone, and then they automatically become estrogen dominant. And that's something that needs to always be kept in mind, because estrogen dominance is a risk factor for breast cancer, uterine fibroids, mood changes, headaches. So that could be just a better understanding of how stress can be causing the symptoms you're having.
Okay, so very often when I'm speaking to women around the age of menopause, they say, and I talk to them about estrogen dominance, they say to me, "Well, I don't have any estrogen left." What do you tell them, Dr. Slavin?
Well, that's why you have to do measurements. There are some women we check and they have no estrogen and no progesterone. They're balanced. But there are some women that are still making some estrogen, but not making any progesterone. So even though they don't have a lot of estrogen, they're still estrogen dominant. Postmenopausal women will make estrogen, the adrenal glands will make estrogen, and even fat tissue can be a source of estrogen production. So you can still have estrogen even if you're postmenopausal and no progesterone, and that's why it's important to check.
And you mentioned comprehensive digestive stool analysis and the ability of those tests to uncover the potential for an overly abundant presence of Candida albicans.
Or any dysbiosis, meaning
That's where I was going.
Okay.
Okay, so what? So other dysbiosis, and might you find other toxic debris in that?
Well, that's the point. The unwanted bacteria or yeast will release toxins that can make you sick. You know, it can give you headaches, give you other symptoms too, abdominal bloating, abdominal pain, so constipation, diarrhea, so you name it, you can attribute it to a dysbiotic gut. And if all the other steps you've taken haven't solved the problem, then you want to start looking at the digestive tract.
And the bottom line of all of this is, I think that if you don't get to the underlying contributing factors of your headaches, the potential for developing more serious issues or compounding the problem, going from headaches to digestive discomfort to other inflammatory symptoms, that's much greater. So in order to find that underlying cause of your headaches, it's crucially important to do the proper testing. And here on Healthcare Hoax videos, we can give you that kind of information so that you understand there are very specific ways of identifying your underlying contributing factors to whatever symptom you might be experiencing. Remember to go to healthcarehoaxvideos.com and like us, share our videos with your family and friends, and if you subscribe, you will get a notification that the next video has been posted. So we look forward to seeing you again on the next Healthcare Hoax videos.